Hi, my name is Candi Reddick, and I'm the founder of Mindful Maroon. And I've made it my life's work to ensure that Black women are informed about their health and they have access to the care that they need and deserve, because many are fighting for their lives. The problem is, too many preventable diseases disproportionately affect Black women. And if a Black woman is queer or has limited financial means, then she's even more likely to experience harm in places that are supposed to help. Many Black women don't even know that they have a problem because they've grown so accustomed to feeling bad. Many of them end up experiencing higher rates of mortality, pain, and undue suffering. And they're told to just chalk it up to something circumstantial. This has a rippling effect on their children, families, and communities. So, Mindful Maroon wants to change this, right? Because another issue is a lot of Black women, they are not getting the support that they need. And they often experience traumatic things in a doctor's office because of implicit bias, medical racism, and they're told to just go about their business. And this is horrendous and horrifying when you actually know something is wrong with you and people just write you off. So Black women are often experiencing a lack of trust because of non-consensual experimentation on Black women's bodies. And there's also a study that's going around, right? If a Black woman has a care provider that looks like her, that she will actually have better health outcomes. And we also see similar data in the birthing community. If a Black woman has a Black doctor, that can be helpful, but a lot of times it's problematic because the average doctor visit is just 16 minutes. And if you are a person of color, specifically a Black woman, it's even less. So I created Mindful Maroon to address some of these issues. And so what we do is, first, we make sure Black women have access to the information regarding diseases that disproportionately impact them, such as lupus, heart disease, and diabetes. And we do this by doing what Black people have done for so long, right? So we actually talk to one another. We gather in community. We uplift each other. We don't just rely on big billboards and radio campaigns. We also, at our community gatherings, we ensure that Black women are supported. They're able to ask questions from experts that look like them. And so by creating safe spaces that are free of shame, they could take the learnings about the different diseases impacting them in their communities and share it with their friends and their loved ones. We also do something else. That is, we connect these Black women to affirming, inclusive, and culturally competent care. And this also includes holistic healers of color. These healers might recommend that they talk to their doctor or they talk to a specialist, but they might say you need to lean into some holistic practices such as acupuncture, yoga, meditation, and herbalism, or it could be a combination of both. And so this care, like other people in the community, they are actually not proximate to Black women, and their solutions often do not take into account holistic health care. And this is problematic because if you don't solve the root issue, you're just gonna throw prescription drugs and other Band-Aids on the problem. Why am I qualified to do this work? Well, I'm tackling this problem by tapping into my MBA. I also am a certified yoga teacher. I'm currently studying herbalism at the Chestnut School of Medicine. I have 15 plus years of strategy, operations, and marketing experience. And I have training in mindfulness, somatics, and trauma. So over the next 12 months, we want to launch some pilot programming that would connect 100 Black women to the information that they need to address their core issue, beginning with the issue of fibroids. We would then connect those 100 Black women, at least 25 of them, to a holistic healer of color so they can start giving them the guidance they need to start tackling their issue. This will cost $25,000. And so we're really excited about having the opportunity to have a corporate sponsor or a foundation underwrite our pilot program focused on fibroids. And we also have a way for individuals to engage our work. And that could be for as little as $25 up to $250. And of course, anything above and below is fine too. You can go to mindfulmaroon.com/donate. Why? This work is so personal to me. I've had so many horrendous experiences seeking care. The same applies to countless friends. And just in the last 3 months, my sister had this little situation go on. She had fibroids, which are benign uterine tumors. She didn't know what was going on. She felt feelings of being bloated, but pretty much every time she talked to a provider, they just wrote her off, like it's not a big deal. So she ended up having 10 pounds of these fibroids removed, which is almost the equivalent of 2 of her children. She's the mother of 3, and 2 of those kids were about 10 pounds. This is the before, and this is the after. She looked at least 6 months pregnant. This should not happen to any woman, and yet this happens to Black women all the time. Fibroids are more severe in Black women. They're diagnosed younger, and by the age of 50, about 80% of Black women will have this issue. The economic toll is at least $17 billion, and it's growing. Black women are sick and tired of being sick and tired. We're not gonna beg anybody anymore to recognize our humanity and offer us the care that we need and deserve. That's why Mindful Maroon is part of the solution, so we can bring dignity back to healthcare and bring holistic solutions to the people. Thank you so much.
Big round of applause. Candi Reddick. Amazing. Questions, comments for Ms. Reddick? Yes.
Healthcare is such a private thing. I'm curious how you get the word out about your services, and how do you reach the people who need your services?
How do you intend to reach the people who need your services?
So that's a fantastic question, and since the beginning, when this idea was birthed in another program and I started working on these issues, I've been so intentional about building community, talking to people. I was well known for going to the farmers market, the food co-op, talking to different farmers, people in this space. A lot of outsiders that are trying to work on this solution, they're not really directly embedded in the community. And so I found by actually being a part of the community, people are eager to have conversations, open up about their issues. And if I'm being frank, there are people within my current cohort who have, found out about the work, and they're like, yo, I got this going on, I have this going on, please help me. And then I've also heard testimonials where I went to a doctor, blew thousands of dollars, got a holistic healer recommendation, problem solved in under $100 in under a week.
Really?
Yeah.
Other questions or comments for Candi? Yes.
I'm curious about your name, Mindful Maroon.
Can you tell us about the name Mindful Maroon?
So it's a combination, so mindful being connected to mindfulness, but the maroon part is what I'm super excited about. So the Maroons were literally Africans that resisted slavery, and they were just like, forget oppression, we're not standing for it. And so they literally ran away, they built entire communities. Within these communities, they maintain their linguistic traditions, their healing traditions, their family structures, and they inspired other people to be free. And so this is also a resistance to the current system. And people often ask, like, are you just shunning conventional medicine? I'm not, because I recognize everybody's different. I maintain health insurance, but I found holistic care to be very, very helpful. And if unfortunately, like a tragedy happened, if I were, injured, I go to Grady, right? I go to Grady. But if I have deep issues, I want to talk to someone who is trained to address the root and not put the Band-Aid on.
Can y'all give a big round of applause to Candi Reddick? Amazing, amazing, amazing.